My name is Dr. Robert Sterling, and if there's one thing I've seen every day in my Chicago office, year after year, it's the false sense that being tired is normal. Patients come through my door shuffling, with dark circles under their eyes that look like bruises, and tell me, "Doctor, I sleep 8 hours, but I wake up feeling like I've run a marathon." And I ask, "How much coffee did you drink today?" The answer is almost always 3 or 4 cans before noon. Friends, the tiredness that improves with a restful night's sleep or a cup of coffee is muscle fatigue, it's lifestyle fatigue. But the tiredness that persists, that deepens, that makes your body feel like lead, that's a silent sign that your liver is crying out for help. The liver is the powerhouse of your metabolism. It processes toxins, converts nutrients into storable energy, glycogen, and regulates blood sugar levels. When the liver begins to fail, whether due to non-alcoholic fatty liver disease, inflammation, or fibrosis, it loses its ability to efficiently perform this conversion. The result? Your body enters a state of chronic low-energy production. The toxins it should filter, such as ammonia, begin to accumulate in your blood, directly affecting your brain and muscles. You experience mental fog. You feel a weakness that is not muscular, but metabolic. And worse, many hasty general practitioners look at your routine exams, blood count, cholesterol, thyroid, and say everything is normal. But what they didn't order was a complete liver panel, ALP, AST, GGT, alkaline phosphatase. And even if these numbers are at the upper limit of normal, the fatigue is already there. Pay attention. If you sleep but wake up tired, if you take stimulants and they don't work, if your legs ache as if you climbed stairs, but you only went from the sofa to the refrigerator, your liver may be suffering. Don't ignore this fatigue. It's not laziness. It's a biochemical cry for help. And the longer you wait, the more overloaded the liver becomes, and the harder it will be to reverse the damage. In the next sign, we'll talk about something you see in the mirror every day and probably ignore. The second silent sign is actually one of the most visible, but paradoxically one of the most ignored. I'm talking about subclinical jaundice. When you think of jaundice, you imagine those movie patients with orange skin and completely yellow, almost fluorescent eyes. That's frank jaundice, usually associated with acute viral hepatitis or severe liver failure. But what I want you to look for today is the pale yellow, almost pastel, tone in the sclera, the white part of your eyes. It's not a vibrant yellow. It's a dirty yellow, like old newspaper. On the skin, especially on the palms of the hands and soles of the feet, you may notice a slightly golden or brownish tone, which many people confuse with a tan or warm skin tone. This happens because a healthy liver processes bilirubin, a yellow pigment resulting from the breakdown of red blood cells, and expels it through bile. When the liver is inflamed, full of fat, or fibrotic, it cannot efficiently capture this bilirubin. It leaks back into the bloodstream. At low levels, it is not detected by the untrained eye, but it is already causing damage. Studies show that total bilirubin levels between 1.2 and 2.5 milligrams per deciliter, within the normal range for many laboratories, are already sufficient to cause this subtle discoloration and, more importantly, already indicate significant liver stress. Here's a simple test I do with my patients. Take a sheet of pure white paper. Place it next to your face, in front of a mirror with natural light. Compare the color of your skin to the paper. If your skin has a more yellowish tone than the paper, pay attention. Then, tilt your head back and look at the inner corner of your eye, that little corner near your nose. The sclera there should be milk white. If you see a champagne, ivory, or yellowish tone, that's a sign. Patients often tell me, "Dr. Sterling, isn't that just tiredness? My eyes turn yellow when I sleep poorly." And I reply, "No, tired eyes become red with bulging blood vessels. Yellowish eyes indicate liver problems." Another location, the palate, the roof of the mouth. Open your mouth wide in front of a mirror. A healthy palate is a uniform light pink. If there is a yellowish tint, especially at the edges, that's bilirubin. Don't ignore the color of your skin and eyes. They are windows to your liver health. If you notice this sign, see a hepatologist or gastroenterologist. Ask for a total and fractionated bilirubin test. And don't accept the answer, "It's normal," without seeing the numbers. What is normal for some laboratories is pathological for your body. In the next sign, we'll talk about a symptom you feel in your stomach and back, which is almost always confused with muscle pain or gas. Dr. Robert Sterling again. Let's move on to the third silent sign, and this is one that worries me the most because it deceives even experienced doctors. I'm talking about referred liver pain. The liver itself doesn't have nerve endings for acute pain. You can puncture a cirrhotic liver and the patient won't feel a sharp pain. What they feel is a dull, deep pain, a sensation of pressure or fullness in the upper right quadrant of the abdomen, just below the ribs on the right side. It's like having a balloon slowly inflating inside you. Many patients describe it as a stabbing pain that comes and goes, or a feeling of heaviness after eating. And here's the classic mistake. People think it's heartburn, reflux, gas, or even muscle pain from poor posture. But this pain has specific characteristics. It worsens after fatty meals because the inflamed liver and its neighbor, the gallbladder, which also suffers when the liver is unwell, try to produce bile to digest the fat and can't. The bile thickens, the liver swells, and the capsule that surrounds it, which does contain nerves, is stretched. It's like stretching a worn-out rubber balloon. The pain then radiates. It goes to the back, specifically to the region between the right scapula and the spine. It's a pain that feels muscular, but doesn't improve with stretching or common analgesics. Patients come to my office saying, "Doctor, I did physiotherapy on my back for 6 months, took anti-inflammatories, and nothing worked." And when I palpate their liver, yes, you can feel an enlarged liver below the rib cage. They almost jump off the examination table. Another clue. This pain is usually worse in the late afternoon or evening because the liver works on a circadian rhythm and its volume increases slightly after meals. If you feel a dull, nagging pain on the right side of your abdomen or right side of your back that doesn't go away with a change of position, doesn't improve with antacids, and seems to come from the inside out, don't ignore it. Don't think it's just gas. Gas causes pain throughout the abdomen, moves around, and is relieved by passing gas. Liver pain is fixed, deep, and constant in intensity. Ask your doctor for a liver palpation exam and, if there is suspicion, a total abdominal ultrasound. An enlarged liver, hepatomegaly, is a red flag. And the longer the delay, the greater the risk of progression to fibrosis or cirrhosis. In the next sign, we'll talk about something that appears on your skin and that you probably think is just an age spot or a harmless wart. Dr. Robert Sterling, straight to the point. The fourth silent sign that your liver is crying out for help appears on your skin and hands, and it's one of the most classic physical findings we teach in medical school. I'm talking about arachniform angiomas, popularly called spider veins, and palmar erythema. Let's start with the angiomas. They are small red lesions, usually on the trunk, face, arms, and neck, that have a bright red central point and small vessels radiating from it, exactly like spider legs. They don't hurt, they don't itch, and you might even confuse them with small insect bites or benign moles. But the difference is that if you press the center of the lesion with the tip of a finger or a glass slide, it disappears completely, and when you release it, it fills with blood again, flowing from the center to the extremities. This happens because the diseased liver cannot properly metabolize estrogens and other vasodilating hormones circulating in the blood. In a healthy liver, these compounds are filtered and eliminated. In an inflamed or cirrhotic liver, they accumulate, causing dilation of small arterioles in the skin. The result? These vascular spider veins. The more of them you have, and the more widespread they are, the greater the likelihood of advanced liver disease. The second component of this sign is palmar erythema. Look at the palms of your hands now. Are they uniformly pink? Or do you notice an intense red, almost raspberry-colored, especially at the base of the thumb and little finger, the so-called thenar and hypothenar eminences? This redness is not a burn, it's not an allergy. It's the same phenomenon, an excess of circulating vasodilators. In classic cases, the palm of the hand feels warm to the touch, and the redness persists even when you raise your hand above your heart, unlike simple redness due to gravity. Patients often tell me, "Doctor, I've always had red hands, my mother too." And I answer, genetics can indeed influence it, but if this has appeared recently or worsened, and if it's associated with other signs we've already mentioned, fatigue, yellowing, pain on the right side, then it's time to investigate. Do a simple test. Press the palm of your hand with your thumb. If the pressed area turns white and then returns to bright red in less than 2 seconds, This indicates active vasodilation. Show this to your doctor. Ask for a liver function test and a liver elastography, fibroscan, if necessary. These signs on the skin are not cosmetic. They are maps your body draws to warn you that the liver is failing to clean the blood. In the next sign, we'll talk about a nighttime symptom that many people think is just stress or anxiety. Dr. Robert Sterling, and this fifth sign is one of the most agonizing and, at the same time, one of the most underdiagnosed. I'm talking about itchy skin, pruritus, that has no rash, no hives, no explainable dryness. It's a deep itch that seems to come from deep within the bones, that worsens at night and doesn't improve with common moisturizers or antihistamines. Patients describe it to me as a prickling sensation like ants or a burning, itchy feeling. This itching has a technical name, cholestatic pruritus, and it happens because the diseased liver, especially in diseases like primary biliary cholangitis, sclerosing cholangitis, or advanced steatohepatitis, has difficulty excreting bile. Bile salts accumulate in the bloodstream and are deposited in the skin. These salts are microscopic and extremely irritating to the dermal nerve endings. But note, it's not just bile salts. Recent studies show that other substances such as lysophosphatidylcholine and autotaxin are also elevated in these patients and are potent causes of itching. The pattern of this itching is characteristic. It is worse at night, often preventing sleep. It is generalized, but frequently more intense on the palms of the hands, soles of the feet, and back, and a hot bath instantly worsens it, while a cold bath provides temporary relief. Another crucial clue: this itching leaves no marks. You scratch and scratch. You may even injure yourself from scratching so much, but the skin does not develop raised plaques as in allergies. It remains normal, only with scratches from the nails. Many of my patients come from dermatologists who prescribed corticosteroids, moisturizers, antihistamines, and nothing worked. And I ask, when was the last time someone looked at your liver? Because this type of itching is a pathognomonic sign, that is, very suggestive, of cholestasis, stoppage of bile flow. If you have intense nighttime itching without apparent cause for more than 2 weeks, especially if you have also noticed dark, cola-colored urine or pale, putty-like stools, also signs of cholestasis, see a doctor. Don't accept a diagnosis of dry skin or soap allergy without tests. Ask for a liver panel including alkaline phosphatase and gamma-GT, which are classic markers of cholestasis. The itching is a cry for help from your liver. It's saying, I'm clogged, I can't eliminate toxins, and they're coming out through your skin. In the sixth and final sign, we'll talk about an invisible but fatal change that happens inside your abdomen. Dr. Robert Sterling concludes with the sixth and most serious silent sign. If the other 5 are cries for help, this is the desperate cry of a terminally ill liver. I'm talking about ascites, the accumulation of fluid within the abdominal cavity. Many people, especially middle-aged men, confuse ascites with beer belly or visceral fat. But the difference is crucial. Belly fat is soft. You can pinch a layer between your fingers, and it's evenly distributed. Ascites is hard, tense, and the abdomen becomes globular, shiny, with the veins of the abdominal wall bulging, a phenomenon we call caput medusae. And most importantly, in ascites, the navel can become flat or even protrude outward, umbilical hernia. How does this happen? When the liver is so diseased, cirrhotic, full of fibrosis, that the blood coming from the intestine, portal system, cannot pass through the liver. The pressure in the portal vein increases dramatically. This portal hypertension forces plasma fluid to leak from the blood vessels of the intestine into the peritoneal cavity. Initially, the fluid is minimal, and you may not even notice it. You might just feel that your pants are tighter, that you need to wear a larger belt, that your weight has increased by 2 or 3 kilos in weeks without eating more. But when the fluid accumulates to more than 2 liters, and I've seen patients with 10, 15 liters of acidic fluid, the abdomen becomes distended like a drum. Other associated signs: you eat little and feel full quickly, early satiety, because the fluid compresses the stomach. You may experience shortness of breath when lying down, orthopnea, because the fluid pushes the diaphragm against the lungs. And the ankles and feet swell, edema. For the same reason, portal hypertension also hinders venous return from the legs. Here's the simplest test in the world, which I do in my office. Lie on your back. Gently tap with your fingertips on one side of your abdomen while feeling with your other hand on the other side. If you feel a wave of fluid flowing through, like hitting a water balloon, that's ascites. Or observe your abdomen while standing. Are your flanks, the sides, bulging? If you draw a circle around your navel, is it at the bottom of a depression or is it flat? Flat or protruding is bad. Friends, ascites is not fat. It's liver failure. If you have a swollen belly that doesn't improve with diet or exercise, especially if you already have other signs we discussed today, fatigue, jaundice, spider veins, itching, go immediately to an emergency room or a hepatologist. Ascites is treatable with diuretics and paracentesis, but it's the stage where the liver is already in decompensated cirrhosis. Don't ignore it. Your body is screaming. Listen, I'm Dr. Robert Sterling, and this was a medical alert. Share this video with someone you love. Until next time.